So Jack Layton's been in the news recently. When he got sick a few months ago, and unfortunately when he passed away a couple of weeks ago, people started coming in and talking about prostate cancer again. It comes up as a recurrent theme. And we actually don't even know what he passed away from. They say it's a second cancer, then they haven't really told us what. That type of a course of decline is not typical for someone with prostate cancer, which is why it brought up a lot of speculation and the such. But it brings up the controversy of PSA testing. And I use the PSA testing as an idea. It has to do with risk. Because the PSA test, if you ask many doctors, it's a lousy test. Because it misses a lot and it picks up things that we don't really care about. So what is the prostate? The prostate, this is the bladder. The prostate is a gland found only in men that will grow until the day we die, as long as we have testosterone living around us. And it is a gland that lives right outside the bladder that goes out the tube that urine passes through. So 1 in 7 men will develop cancer at some point in their lifetime. 1 in 27, however, will pass away from it, which means that many people who have prostate cancer will die from something else, which is a good thing. Symptoms of prostate problems of any kind, and if we all live to be 120, the men in the room, we will all have problems with our prostate because they keep on growing and growing and growing. Urinary urgency, frequency, hesitancy, weak urinary stream, blood in urine. The problem is this is the same list of symptoms for prostate cancer. And the incidence of prostate problems is very high, very, very high. The incidence of prostate cancer is much lower. The PSA is a protein that's released by the prostate that, when it's really high, is suggestive of a possibility of cancer. The problem is screening is testing in people with no symptoms. So if someone goes to the doctor and says, I'm having problems with my prostate, or I'm having problems urinating, and he orders a PSA test, he's not doing it just because. A screening test is what happens when somebody goes in and says, I feel great, test me to make sure I'm going to live until I'm 120. And this is where it becomes a problem, because it doesn't equal a diagnosis. And I would think of the last 3 men that I've had a high PSA test on, only 1 of them has had cancer, and the other 2 had biopsies that said they don't. And the biopsies are not pleasant, they're not fun. And so the question is, did I need to send all 3 for assessment? This was put out by the Ontario College of Ontario Cancer Care Ontario a couple of years ago. And this is what happens if you send 100 men for prostate cancer screening tests. So if you do a blood test, you'll see there are 5 men who will be told, you may have cancer, when they actually don't. 3 men would find out that they do have cancer, and 2 men would be completely missed altogether. And so the question is it a good test? You're testing a lot of people for very, very little gain, and you're scaring the bejesus out of these 5 people. And these 2 you're missing completely. So it boils down to risk. And this is something that I warn patients about all the time before you do anything. It could be a medication. It could be a test. It could be going to see a specialist. Everything has risk. When you go and cross the street every day, you are taking a risk. You try to come up to the curb, you look both ways, you hold hands, you cross on a green light, and at some point you're going to decide you're going to take that step off the curb and cross the street. That is, you're taking your own life in your own hands. Most people get to the other side no problem, but some people get hit by the car. The problem is in life, bystanders have risk too. And standing on the curb has its own risk. Sometimes a car jumps the curbs and hits the guy on the sidewalk as well. And so nothing is without risk. And this is where everybody has to weigh what's the right answer for them. So they did a big study in Europe and in the United States that was published a couple of years ago that looked at how many people you need to test. And what they found, that the PSA test in men with absolutely no symptom meant you had to test 1,400 men, treat 48 of them for cancer to save 1 life. Now if you're that 1, you think that, wow, that was all worth it. But you never know if you're that 1. You could be one of the 48 or 47 other ones who were going to live anyway, who had all the cancer treatments to die from something else. or to suffer from something else. And so the going recommendation as we go along is the PSA test is not great. It might be right in certain populations. It might be right if you have certain family histories, but it may not be right for everybody. And this is where a lot of the controversy comes up. And so in the paper in the past couple of weeks, you haven't really seen a lot of push from a lot of specialists saying, go get tested for prostate cancer. When Lance Armstrong had testicular cancer, or Katie Couric's husband had colon cancer, you had a lot of push in the States for this type of thing. And if this happened, had Jack Layton been in the States, I actually think you would have a whole flood of testing. The Americans are much more prone to testing than we are in Canada, because we actually try to take that step back a little bit. But for the vast majority, people know that the test is not great, and they're trying to balance the risk. And my best advice is to weigh the risks for yourself. And if you have symptoms, you speak to your doctor. And otherwise, you have to decide for yourself if this is the right time. But if you have symptoms, speak to your doctor. This is the time where you get checked out.
But at a certain age, even if you don't have symptoms, shouldn't you be followed, say, from year to year to see the trend in your...
So the older you get, the less good. The older you get, the less useful the test becomes. Because as we get older, our prostates get bigger, no matter what. So the test is actually more useful in younger men than it is in older men as a screening tool. It does matter over time for following people who have prostate cancer, but that's totally separate. For people who don't, the trend, they've looked at does following the trend make it a better test than not? And in people without symptoms, the answer is probably not.
Is there a genetic component? Like if someone has
Yes.
prostate cancer in the family?
Yes, so people who have prostate cancer in the family, it's definitely one of the recommendations that people get tested. African Americans actually are higher risks, and so in theory you would start them actually even 10 years earlier. In general, for the Caucasian population, we start at age 50 discussing it. In the African American, it's 40.